6 years ago, I suddenly found myself unemployed and then underemployed.
And we just couldn't afford it,
If I did have insurance, maybe I would have went right away. But since I didn't have it, I know it's going to cost a lot of money, so I couldn't afford it, so I didn't go.
I was getting sicker and sicker and not having a doctor, and I didn't know what I was going to do.
Because of preliminary things on me and pre-existing conditions, we could not get health insurance for us.
I had a high blood pressure, high cholesterol level, and I was a walking hospital.
The gallbladder thing had been going on for a long time, and I really hadn't got it attended to because of it costing so much to go to the doctor.
And we tried to get insurance, but it was just not affordable for us.
As a former president and CEO of NFIB, the National Federation of Independent Business, the nation's largest organization lobbying for small business, the #1 issue we found around the country for small business was the lack of availability and/or high cost of health insurance. The working low income in America, 45 million of them, are desperate for health care help. Well, we have an answer in Nashville, not from the government, but from Faith Family Medical Clinic, providing quality, caring health care for working low income people in our community.
With not having insurance, you feel like everything is hopeless at that point. You're like, okay, I got this diabetes, I'm dealing with them, and you have no hope. And when I came here, it was like, thank you, I needed the help.
Insurance is not offered at my job. And I have been turned down several times because I have diabetes also. The medicines and the treatment for my eyes was going to be into thousands of dollars. There's no way I could have afforded to have done it.
A day doesn't go by that we don't see a new patient that presents here who has a certain sense of hopelessness because they just feel that there's no way they're going to be able to continue to get decent care that they can afford.
Yeah, I was one of those that fell through the cracks. Being in my 50s, it was hard to find the type of job that I'd had before. No health insurance and having to really watch my money. A lot of the places out there with no health insurance acted almost like you were a leper when you called. Saw Dr. Henderson on a TV interview about the opening of Faith Family, and I thought, this man cares. And I knew I'd always been a giver, never a taker. I didn't want public assistance. I wanted medical care, but I wanted to pay for my medical care. And this has been the most wonderful experience with these people here. They care, everyone is treated the same, and you walk out with your pride intact.
The thing that's so attractive to me about Faith Family is its cooperative effort. It asks the patient to do what they're capable of doing, and we want it to be affordable, and we want it to be something that they can manage. But at the same time, it's not doctors doing to people without the effort and the energy and the contribution from the patient themselves.
One aspect of our health delivery here, our medical care delivery here, that makes it so positive and so strong is that we have a roster of specialists who have agreed to see our patients for a very low cost. They're top notch. They're some of the finest specialists in Nashville.
Well, I think that a lot of times when a patient calls on the phone, they're not sure. They're not sure about the way they're going to be treated, the kind of facility, and they're surprised when they come to Faith Family and see that we have state-of-the-art technology, that we're a clean and up-to-date facility. We've had patients leave here crying, thanking us for what we've been able to do for them, what God's been able to do for them through us.
I came here because I wanted to work with patients who really needed care, and that's what you find when you come here. People who've gone for a long time without medical care, and some of their physical situations are very complicated, their emotional and financial situations are very complicated, and I love working here because Here we emphasize the whole person and taking care of the whole person, their physical, emotional, and spiritual needs.
No pill that we can give them a script for is going to fix their life. But more than anything, they want to come here and know that whoever it is that's taking care of them actually does care about them.
I try to integrate the medical aspect with the spiritual aspect. You know, we can pray for patients, we can tell them we're praying for them, we can pray with them in the room. I mean, that is totally acceptable, and that's why we're here. So I think that's great.
Karen and Josh are owners of a small grocery store in South Nashville. They too were unable to get insurance. Karen was diagnosed with colon cancer after coming to Faith Family. She was able to see specialists and receive affordable treatment.
So I think the reason I'm alive today is I'm sure, God has plans for me, and also He used Dr. Henderson and Faith Medical. I am telling everybody that I meet that Dr. Henderson and staff here, they're angels, I think. I think Dr. Henderson has wings under his white coat. I really think so.
Faith Family has been an advantage to me because I've been trying to get out of the poverty mentality of the people before me, and this has been a great transition for me to be able to work and still be able to pay when I come to a clinic, but yet it's still affordable for me to keep my expenses in my budget. So it's been a very good transition for me.
It takes away the fear that, if I get really sick, there's a place for me to go.
I came to know about Faith Family because I was on TennCare, and then it got taken away from me, and I appealed it because I think it's 3rd phase chronic hepatitis C. Dr. Henderson is my doctor, and I'm sorry, but when you think you're dying and you don't, nobody wants to take you. Nobody will see you if you don't have any money or any insurance. And I came in and they saw me. They started immediately making arrangements for me to see specialists. And I'm talking about really nice specialist doctors that didn't treat me like that I wasn't paying. You know what I'm saying? And they began to help me. They took tests, and then they put me on some medication. And Dr. Henderson, he prayed with me. And there's times that I've even called here just because I was feeling bad. I thank God for a place like this that'll see people like me.